Hello and welcome to this month's Wild World of Wounds. This month, how to do a good hand exam. So we see lots of injuries to the upper extremities, abscesses, large hematomas, burns, crush injuries, open fractures, and it is very important that we know how to do a good hand exam. How do we evaluate if the distal, median, ulnar, and radial nerves, the three nerves that go distally to our hand, are still intact and functioning? Now today we're not going to go over the circulatory side. We're not going to talk about evaluating the joint above and the joint below an injury. We're not going to talk about compartments and evaluating the skin, which is all part of an extremity exam. We're just going to talk about evaluating the nerves, both the motor and the sensory distribution. So are you ready? Here we go! Alright, so median and ulnar nerve, sensory distribution. We're going to go over the sensory distribution first. So see here that we have thumb, index, long, and ring finger. By the way, it's nice to name the fingers rather than number them, since everybody numbers fingers differently. Some people include the thumb, some people don't. And often people will call this the short finger, or the pinky finger. Short sounds more medically inclined than pinky. So the first 3.5 digits is covered by the median nerve. So if you can feel that, then that sensory distribution is intact. So if you have your thumb, index, long, and half of your ring, and you can feel that, then that's the median sensory distribution. Pretty simple. The rest of it, as you can see here, half of your ring finger and your short finger and into the palm is the ulnar nerve. Alright, so far so good. Median, first 3.5 digits up to the ring, which is split in half, and ulnar. The back of the hand looks more complicated, but it's not that bad. Again, it's divided at the ring finger, but this time it's the radial nerve and the ulnar nerve. Again, the ulnar was the same one that did those same fingers on the palmar side. But now it's just the back of the hand. So instead of the median nerve doing the first 1, 2, 3.5 digits to the ring finger, it's the radial nerve. But you can see these little green spots on these same 3.5 digits, thumb, index, long, and ring. Well, that is the median nerve wrapping around and getting the tips. So if you're going to test the sensory distribution of the radial nerve and say, hey, can you feel where the radial nerve is, a nice place to check is that first dorsal web space. A little light touch sensation there, and if it feels normal, that lets you know that the radial nerve sensory distribution is intact. It's nice to do it here because you can see it's really pure radial. As you get up near the digits, you can get some crossover. So if you're testing in here and saying, can you feel it? Well, you might be getting more median than radial. That's why first dorsal web space is a good place to check. And then let's now talk about the motor distribution. So again, we did the sensory, we did the median and ulnar. On the back, we did the radial and ulnar. Now let's do the motor distribution. Now again, this is assuming that the injury we're dealing with is somewhere proximal to the hand in the upper extremity. And that's because as you get lower into the hand itself, there's a lot of little branches that you can hit, and the exam has to be a lot more detailed and specific. We're going to go over a general exam to make sure that these distal nerves are intact. And we're going to assume a more proximal injury today. So, the basic motor function. Well, we all know that median tends to be the flexors, and radial tends to be the extensors, and ulnar tends to be the intrinsics of your hand. But how do you test that, and what's a good quick way of seeing if each are intact? Well, the median nerve controls that thenar eminence, and the three muscles in our thenar eminence, including the opponens pollicis. And that's a really important one, because that allows us to grip things. That allows us to be Homo sapiens with an opposable thumb, which is always a good thing. So the median nerve, a great way to test it is, can they oppose their thumb? Since the median motor goes to that thenar eminence. So can you oppose your thumb? Because that lets you know that everything more proximal is intact, for the most part. And we'll go over one other small detail in a moment. So can they oppose their thumb? That's the median nerve. How about the ulnar nerve? Well, that does the intrinsics of the hand. So can they abduct their digits and adduct their digits? So you can have them do this. Now don't let them fool you by flexing to try and bring them together. That's a different function. Keeping them straight, can they abduct and adduct? That's your ulnar. And then radial, well, radial does extension, but to really try and get a nice, easy way of checking extension, just have them extend their thumb. So like they're hitchhiking. So, to review, motor of the median. Oppose your thumb. Touch your thumb to your short finger. Ulnar. Separate your fingers. Put them together like a karate chop. Radial. Extend your thumb. And then for the sensory of those same nerves, median. Well, can you feel that on your thumb? If I'm not sure, maybe I'll take a paper clip, make a 2-point testing device and say, can you feel 2 points or 1? And see if they can really discriminate. So, median, ulnar, radial, first dorsal web space. So that's a quick and dirty test of the 3 distal nerves to your hand to see if they're intact. Now, there is one more branch I think I should just briefly mention off the median nerve called the anterior interosseous. Big fancy name, but all that means is right here in the center of your anterior forearm, there's a branch of that median nerve that comes off and goes to the flexor pollicis longus and 2 of the tendons of the flexor digitorum profundus. And all that means is that it lets you flex the thumb and flex the tiny tips of your index and long finger. So how do you test that little branch of the nerve, of the median nerve, is intact? And that's important to test because that's all that nerve does. So you can do everything else, and if you don't test that specific function of flexing those digits, that nerve can be out and you won't know it. Well, the common test people do is the OK sign. Because to do an OK sign, you have to bend the tip of your thumb and you have to bend the tip of your index finger. Otherwise, it kind of looks like, I don't know what that is, a squished OK, a duck. I don't know what that is, whack, whack. So if it's not a circle, if it's a duck, then that nerve isn't intact. The anterior interosseous branch of your median nerve lets you do that. So, to review, let's go over the sensory distribution one more time. I got an injury to my forearm or arm here somewhere, and I want to know, is the sensation to all 3 nerves intact in the hand? Well, can you feel that? That's median. Can you feel that? That's ulnar. First dorsal web space, can you feel that? That's radial. All the sensation is intact. How about motor? Well, can you oppose your thumb? That's median. Can you extend your thumb? That's radial. Can you separate your digits, including your thumb, and then pull them back together? That's ulnar. Median, ulnar, and radial, sensory and motor intact. Alright, I hope you enjoyed this month's Wild World of Wounds. We'll see you next time. Bye for now.